So today we'll be speaking about the specialty, which is ophthalmology. A very warm welcome to you, doctor.
Thank you very much.
Yes. To describe doctor, doctor has completed his MBBS from MGM Medical College. Doctor has also completed his DOMS from Rural Medical College. Secured All India rank 24 in DNB NEET. And doctor has completed his DNB in ophthalmology from a prestige Arvind Eye Hospital. Along with that, doctor has completed his long-term fellowship and published papers and posters in national and international conference. So once again, a very warm welcome to you, doctor. We'll start the session from here.
Sure.
Doctor, to start with, could you please give an insight about what is specialty all about, and if any doctor chooses this specialty, is there any sub branches under this particular specialty?
Yes, basically the ophthalmology is totally related to your eye disorders. Okay, eye and periocular disorders. Here, definitely there are super specialties, but not as like DM or MCH, where after post MD or post MS surgery, you have to do one more degree. Here, there is no degree as such, but there are fellowships, super specialty fellowships. Total around 8 to 9 super specialty fellowships are there in ophthalmology. You have to choose one of them. You can do multiple, but you have to invest that much time in that thing. So basically, there are short-term or long-term fellowships depending whichever you want to choose.
Okay, doctors. So basically, what is this specialty all about? Like, as every specialty has their own description, has their own details. So is there any specific thing that doctors should know before choosing this specialty?
Yes, this is basically the surgical branch where after MBBS we choose like two major branches are like one is the MD side, which is the physician side, and one is the surgical side, which is the surgeon side. So those who are interested in surgical field, that too, the ophthalmology is really, it is the micro surgery kind of thing. So basically who are interested in that thing should come to this field. Though like people who like a physician thing should not prefer this branch.
Okay. So, doctor, could you please give an insight about what is DNB? If anyone does DNB and anyone does MD, is there a difference in career opportunities or in this specialty?
Basically, few years back, Government of India has passed one bill in which MD and DNB degrees both are the same. But there is a small difference if you want to give services in government, like government college or in a civil hospital, government hospital. So in academic career wise, MD degree or MS degree is definitely higher compared to DNB. After completion of DNB, you have to do 2 year service, basically lecturership or a resident kind of thing in government recognized hospitals or medical colleges to come like a MD degree. So after that, you can join government hospital or medical college as a lecturer, then associate professor. So after completion of DNB, you have to do 4 posts, the residency post. And compared to MD can directly join as a lecturer in academic sections.
Okay. So, doctor, could you please give an insight about what is the career opportunity in the specialty, and what is the work-life balance when a doctor chooses the government hospital or a private hospital, or doing their personal opening their personal clinic? So, how is the workload and how is the patient handling and everything in the specialty?
Yes, comparative to other emergency branches. What emergency branches? I mean those who deal with the trauma or MD or MS general surgery. Those are the emergency branches. In ophthalmology, compared to these branches, emergencies are less. There are like you can get ample of time, especially like you can get 6 to 8 hours of sleep in your like career. according to my opinion, this is very good branch actually, which has like a balance about the you will get the patient exposure also, you will get ample of family time, you will get ample of like time to like fulfill your hobbies also. Not that much load is there, not that much emergencies, but you have to invest like time in this field, because as we are progressing, this field is also moving towards the super specialty. So after MD, like MS or DNB, you have to invest your like 1 or 2 years in doing fellowship, super specialty fellowships. So it is time consuming also.
And could you please give a difference between, like, if anyone does like start working in a private colleges and in a government colleges, will there will be the same kind of work balance, or it will be a different?
Basically, it will be the same, because the all government colleges have like now investing a large amount of money. Basically, ophthalmology, as we are progressing, ophthalmology is totally depending on the machines. The machine dependency is very high in ophthalmology. If you are planning to join in your hospital, that too like any government or private hospital, then amount is not at all any problem for you. But if you are thinking about the private practice, the big thing is the investment. Okay, we are the like machine dependent. So basic, if you want to start OPD services, private clinic, so at least you have to invest like 20 to 25 lakhs basically. If you are joining the private hospital or government hospital, that part is not towards you. So workload as such in government or private, it will be the same. The basic difference will be either you are doing private practice or you are joining somewhere. So if you are like thinking of doing private practice, you have to be ready with like ample amount of money.
Okay, so doctor, most important thing now, like what is the income basis here? Like, do the doctors earn a good money in this field, or it's like they have to make their mind that in starting they will not earn good, and by gradually once their position increase, then they will earn good?
Yes, if you compare to like any branches, any medical field branches, for newcomers, it will take time in the market to settle down. Basically, ophthalmology, in our field, the cataract is our bread and butter, which is the most common thing we do operate. If you'll ask me if you want to do any operation, I'll definitely choose a senior doctor for obvious reasons. So you have to give time initially, at least 2 to 3 years. It is not if you will get MI and you go to any nearby hospital, any nearby physician, and you get treatment. It is not like that. It is not at all emergency. So people will take time to get operated from you. Yes, for OPD services, they will come, they will get checked, but for surgical, to turn the patient for the surgery, it will take time. But yes, for income wise, all medical fields are good only. It is nothing like this field earns more and this field earns less. It totally depends on you, how you practice, how is your surgical hand. Income is there. Yes, you can choose this branch income wise also.
Okay, so doctor, like anyone who is interested, once they complete their MBBS and doing this specialty, wants to pursue their career outside India, so is the scope for the specialty is there? If anyone like wants to go to UK, US, or Australia and work there, so do they have scope in other countries also?
Yes, they do have, but comparatively to physician branches in outside countries, they don't give surgical branches to any other country people. They will prefer to their own people. That's what I heard, and that's what I saw. I have visited US. I have visited a few ophthalmological institutes over there. So basically, the surgery part they will give less. the preference to other students will be the less. You will be preferred if you will do DNB from good institutes, good renowned institutes. Yes, for DNB students, they are preferred. But overall, the preference for the surgical branches is less for the other country people.
Okay. So, doctor, any other message would you like to give to the doctors when they watch the video? As you know, like all the doctors who will be watching this video will be the student who have just completed their NEET exam and will be looking for a specialty. So, any message would you like to give them so that it's easy for them to choose their specialty?
Yes, the message is very clear. Those who like the surgical branch, they are very welcomed in this branch, because I know like few people who have chosen this ophthalmology field. They have done 1 or 2 postings in this and they have left there. They told कि ये मेरा branch नहीं है. Like they were least interested in this thing. This is a clear surgical field. Those who are interested in surgery, they should prefer this branch. And second thing is, you should be clear about your future, what you are going to do. You are going to attach to somewhere, or you want to do private practice. According to that, choose this field, because in this field investment is very much higher as compared to other field. You can compare this field with radiology. Like in radiology also investment is more. Like that only ophthalmology is moving towards the machine dependency more. So if you are doing private practice, you should be ready with good amount of money. So before choosing the branch, you should be clear whether you want to do private practice or you want to attach somewhere. Second thing, being a surgical part, complication is the part of parcel of your surgery. So you should be ready for that thing. And third thing is also, it is moving towards the super specialty thing. So after MBBS, you take 3 years for your MS or DNB. If you are doing DO DNB, then it will come to 4 years. And after that, you should be ready for at least 2 years to study, to do fellowships and all things. So post MBBS or post your NEET, you can take almost 5 to 6 years to complete this thing. And after that, you'll come out and you'll be ready for your future. So these 2-3 things you should be ready for you time. Like people will think after MBBS I will do it like 2 or 3 years and then I will stop. No, you should not think like that. You should be ready for at least 5 to 6 years. Second thing is, try to do from good institutes, at least your PG or fellowship. And third thing, if for private practice, ready for the investment.
Okay, thank you so much, doctor, and thank you for answering all the questions. I hope this session will be very useful for the doctors. So thank you once again for giving your time, and I'll end the session here.
Thank you very much. My email ID is with you people, so you can contact me. If you have any queries, any of the students, you can directly ask me.
Sure. Thank you so much, doctor. Yeah,
thank you very much.